Today's program is actually our effort to measurably improve the health of the people who live and work in the western suburbs of Chicago. This is a grant presented to us by Community Memorial Foundation to address issues of diabetes, hypertension, obesity, which is very prevalent in our community. So I hope all of you take advantage of these monthly meetings where we can address your issues and also show you how to have a better lifestyle as far as exercising properly, eating healthy food, and addressing the issues of elevated sugar as well as your weight to live a better healthy lifestyle. Thank you.
I'm Santosh Kumar. I'm the Executive Director of Metropolitan Asian Family Services. What I have to tell about these other services which I just included under our umbrella, that is called Metropolitan Family Clinic and Metropolitan Home Health. The reason for all this, to give our community all the services under one roof, so that they can have a medical service right here, Monday to Friday, Monday to Saturday also in Chicago, and they can have operation somewhere, and they can be given a skilled nurse care along with the home care, which we have a chore care. And we have elderly care, we have a public benefit program, and today we have concluded a study for our healthy lifestyle for the western suburb people who either work here or live here, and this was funded by the Community Foundation. And our goal was to give our community a awareness changing little food from unhealthy to healthy, or moving around for 5 minutes maybe. They can reduce their diabetes, they can reduce their blood pressure, and they can be less fat or less obese. And today we have found many good results out of this study. And whosoever watching this video, I request whole community to come and have benefit of these programs so that we can live healthy, happy, and prosperous in this country. And they can use all the services under one roof here. Thank you.
Good morning. This is Sonali Raheja. I am an employee of Universal Industries. With Universal Industries in mind, what we think of is home care services, we think of home health services, we think of the medical services, we think of the residential services. So in all, we provide an integrated services to the seniors, right from the comfort of their home to the comfort of living in our residential services. And we provide all emergency services in form of the medical services, the public benefits, and the home health, where the nurses can come to your home and take care of you. In that series of serving the individuals of the South Asian community, we have conducted a study with the conjunction with the Community Memorial Fund, and the study is on the people who live or work in the northwestern suburbs of Chicago. Here we have had 4 sessions. The first session comprised of screening the individuals from the age group of 16 to 64 for BMI, obesity, hypertension, and diabetes. So all the individuals are screened, and then we had spread awareness about exercise, healthy eating, healthy cooking. The second session comprised of salad competition, where the participants were encouraged to get their own salads from home, and we also prepared a couple salads here. Then we told them the right way of making salads, the right way of cooking the healthy foods, and then we had a session where everybody ate the salads, enjoyed, and went back home. The third session comprised of exercise, which told them how many times a week they need to exercise and for how long, and what are the correct techniques to exercise according to their age, their demographics, and the food that they eat. This is today the last session of the study, where we are re-screening all the participants for the last time, and we are comparing their vitals from the first session to the last one. And now I can say that we have successfully lowered their BMI, their blood pressure, and their obesity. So I consider this study as successful, and this has been successful with the participants and with the support of everybody who has been involved in this study. And today I can say that everybody who has been through the study is more aware, and then they'll pass it on to their friends and family. So for everybody who's listening this message, my message to you is that we have a gamut of services here. We have the clinic, who's helped a lot of people get to a better lifestyle. Why not join us and then pass it on to your friends and family to be a part of this? Thank you so much.
My name is Afan Mohammed. I am working for Universal Industries. My position is as a journal manager. We are serving the community from last 22 years, and we just started the Metropolitan Family Clinic 2 years ago, and we have two locations. One is in suburb in Naperville, and one is in Chicago office, and we have residential doctors, and they are good, taking care good. We are open Monday to Friday 9 to 5, so you can come and visit our doctor. We are taking all the Medicare, Medicaid, and plus if you don't have the Medicare and Medicaid, you can come, and we are taking the cash also. So if you need some information, you can contact our clinic. And we just started the Metro Home Health Care. We got the license in January 2014, and we were taking the outpatients from the hospitals who were discharged from the hospital. So right now we have 35 patients so far. So the reason I am giving the interview, we need your support to join us and give us the support and encourage our community so we can look forward. And my company MAFS is also serving the community for the seniors from last 21 years, and we are taking all the in-home cases, and we have the adult daycare services, and we have 8 locations right now, and looking forward for the Orland Park location, and hopefully we will open the ADS services in Orland Park also. And we need your support actually. So please join us and support. Thank you.
Hi, my name is Paula Patel, and I am the clinic manager at Metropolitan Family Clinic. We had the pleasure of working with Metropolitan Asian Family Services, MAFS, as most of you know, to work on a healthy lifestyle session that began in January, and we called it New Year, New You. What we had is a group of about 70 people that came in, and we discussed how to live a healthier lifestyle, how to decrease your blood pressure, how to decrease your weight, how to decrease your blood sugar levels, all in efforts to avoid diabetes, hypertension, and obesity, and the unfortunate side effects that come from those diseases. So we targeted our South Asian population. Our first session was in January, and it was a great success because we got to get baseline readings for about 35 people, and eventually, we had a second session to finish off those the first group, and we got to discuss, generally the effects of diabetes and the threats of high blood pressure on our community. Our second session, we finished off our first group for blood testing, but we also had a salad competition and discussed healthy eating and also alternatives, as our South Indian food is not always the healthiest, and we all very focused on taste. We all want our food to taste good. So we discussed how to make our food taste really good, but with healthier alternatives, which was, again, a great success because we had a salad competition, and our participants, brought their salads, and we had a little contest, and they really enjoyed it. So it was a pleasure to host our second session. Our third session, we discussed exercise and the importance of exercise, how much you need to exercise, and what exercise really means. A lot of our participants have been, for now, the past 6 months, have been increasing their exercise level, as well as eating healthier. And at the end, today is our last session, so we are looking at some of the numbers, and we're already seeing progress as in there are lowered blood pressure readings from the first sessions, there's lowered glucose levels, there's lowered hemoglobin A1C levels, and lowered BMIs. So we're really excited to put the results together and see what the results show. But we're super excited that we were able to reach out to our South Asian community especially and have them participate in this study. I urge that as the years continue, we hope to get, work more in collaboration with MAFS, as well as get, some grants to really benefit the South Asian community in living a healthier lifestyle. So I urge all of you to join us in our future endeavors and our future programs. You can stay in touch with us. You can contact us at our Chicago office or Naperville office and our 8 different locations that we have throughout the city. Illinois, and just get involved, because the healthier you are, the longer, happier lives you live, and if we can help you in any way, it would be our absolute pleasure. So I hope to hear from you soon. Thank you.
Hello everyone, my name is Mukesh Panchal and I am a nurse over here, and I am working as a nurse, and we are doing study here, community Memorial Foundation grant, and we await the people living in northwestern suburb. So we await them, and we did 4 sessions, one for screening, the second one is salad competition, and third one is exercise, and fourth one is rescreening. So first we have to check the blood pressure and aware them what we have to do. The second complication, we have to teach them healthy diet, what to eat, what to do, and the exercise. So different type of exercise we show them, and the last one is rescreening. So we check difference between first screening and the last screening. Okay, thank you.
Good afternoon, everyone. My name is Connie Togaru. I am a Benefit Access Coordinator for Metropolitan Asian Family Services and Universal Metro Asian Family Services. Today, we have been involved in a community health care fair where we have allowed our community to benefit from health screening such as body mass index, blood pressure testing, and diabetes testing as well. All this is in with the scope of educating our community, especially our Hindi community, our European communities, and the general public of the benefits of a healthy diet, and also the benefits of taking care of ourselves so we can be part of society and to contribute as much as we can. Today's event has been very successful, and these kind of health fairs are beneficial to our community because it educates and it promotes healthy living and education for a better outlook on life and in our community. Thank you very much for having me, being a part of this program. Thank you.
Hello, my name is Dr. Manjusri Majumdar. I'm a family practitioner, and I'm practicing for 30 years or so, and I work for Metropolitan Family Care, which is our clinic in Naperville. We also have another clinic in Chicago, and the clinic was started for Indian and Pakistani people, mainly Asian people, mainly Indian and Pakistani people. And we are conducting a study. We have already had 4 Saturdays we were here in Naperville conducting this study so that we can make people aware of healthy eating and healthy lifestyle. And that study is very successful, and we have made a difference with some people who has lost weight, whose BMI went down, whose blood pressure is controlled. And I will encourage everybody in the community to come forward and think about healthy eating, healthy habits, so that we live longer. Our blood pressure stays away, our blood sugar goes down, and so the biggest issue is blood sugar is very high in in Indian and Pakistani community because of our food habits. So this study was conducted just to make people aware of certain kind of lifestyle, and with exercise, diet, people know about DASH diet, they didn't know, okay, then losing weight and keeping diabetes away so that we live longer. Also, I will request everybody in Indian and Pakistani community to come forward and ask your friends and family, everybody to come and get aware of this thing. Is health education, and through that also you will know if you have any kind of disease, and we will encourage you to follow the diet and exercise, and if you can make it, you can come to Metropolitan Healthcare, which is in Naperville and Chicago, both places. We are open from Monday through Friday, okay, and some of the Saturdays are open in Chicago to benefit you, so that you can schedule appointments that way.
Hi, I'm Prashant Kumar, and I'm the IT director of Metropolitan Family Clinic. Our clinic is based in Chicago and Naperville. Our times are Monday through Friday, 9 to 5, and we're here to serve the South Asian community. One of the ways we serve the South Asian community is with grants like this. We're a part of the Healthy Lifestyle Grant along with MAFS and the Community Memorial Foundation, and together we want to study why South Asians have high blood pressure and diabetes, why our sugar is always high. So we're working with them to take vitals over a 3-month period of the same 65 patients, and trying to make sure with education and with tracking their vitals that they show a 10% improvement, and that's what we are here to do today. So we're here to study South Asian diseases and what the problems in our community, and trying to fix them and see why our community has these problems.
Mi nombre es Carla Guajardo, trabajo por la clínica de Metropolitan Family Clinic. Soy MA certificada. Estamos aquí el lunes a viernes 10 a 4. Estamos aquí haciendo un estudio para ver si la gente bajar de los diabetes, hipertensión. So we were doing a study combined with MAFS and Community Memorial Foundation, testing people for diabetes, hypertension, trying to get a 10% decrease.